The situations in the health facilities in the Gaza Strip have reached a critical crisis level. Vast overcrowding of these health facilities because of over 10,000 wounded patients has resulted in overcrowding within these health facilities and hospitals. To be very clear, the capacity of the surgeons within Gaza is very high, very highly qualified, professional, capable surgeons and nursing teams within these facilities. How the hospitals are currently dealing with this situation is by early discharge, by sending patients home before they're really ready to be discharged home in order to have beds available for the additional wounded that are coming in. The ICRC is assisting this situation by having a daily presence in Shifa Hospital, the main hospital in the Gaza Strip, by having the specialist surgeon available in the emergency department to work with the team there to provide timely and appropriate care to the wounded. ICRC is also having a surgical team presence in Shifa Hospital with a specialist vascular surgeon and a full surgical team available now working in Nasser Hospital. ICRC is also assisting this situation by the provision of vast amounts of drugs and disposables to the central level of the Ministry of Health. As always in conflict, there are always groups of health people that are left out of consideration. And it is generally those people with chronic diseases. Those people do not have access to primary healthcare facilities because they are closed or have been damaged, or staff have not had access to these health facilities. Now, several more health facilities are being reopened at the primary healthcare level, and ICRC, directly through the Ministry of Health, will assist in drugs and disposables for these patients. The future of Gaza in the health system, it will be focusing on three main areas. That is, rehabilitation of those damaged facilities. Some hospitals have been collateral damage or have been targeted in this situation. Rehabilitation of these facilities is necessary in a speedy manner to ensure that these hospitals can return to functionality, to ensure that these hospitals can receive patients again. PHC facilities also need to be rehabilitated to ensure that there is enough coverage for the population at the primary healthcare level. At the primary healthcare level, with the Ministry of Health, we will continue to support them to reopen their primary healthcare facilities by ensuring that they have the drugs and disposables available. The ICRC will continue to support the Ministry of Health at the central level, as we have done for many years. We will continue to provide drugs and disposables to these health facilities to ensure that the wounded receive treatment. We will continue to provide support to the primary healthcare level to ensure patients are receiving medication, and we will work closely with the Ministry of Health to ensure that the damaged facilities are under rehabilitation.